Hello, I am Dr. Nagaraj Puttaswamy. I am a laparoscopic surgeon at Punya Hospital, Bangalore. Appendicitis is a condition which is a surgical emergency. It has to be treated surgically only. We as a surgical resident or a registrar or a surgical student have learnt appendicectomy getting performed conventionally by open methods. But as it is evolving and we have grown and we have become mature, I've seen laparoscopic appendicectomy being the perfect choice for managing acute appendicitis. See, it's not that we cannot operate conventionally. We can comfortably operate conventionally, which all our seniors and my teachers have done successfully. But laparoscopic appendicectomy has a significantly higher advantage over open appendicectomy. Laparoscopic appendicectomy is performed with only 3 instruments or 3 ports, what we call. We usually put a telescopic port in the umbilical region and 2 other ports which are used as operating instruments, all of them being 5 mm each. And finally, identify the location of the appendix, seriousness of the condition. We try to disconnect the appendix from the cecum and retrieve it out of the abdominal cavity. Depending upon the spillage of toxic material which has already happened or the exudate which has happened, we try to lavage that area. That is, I mean to say that clean the area with the help of normal saline or medicated solutions, whichever is required as on the operating field. We have all the possible options. Say for example, the appendix is abnormally located in the retrocecal region, but still it is badly infected. We can comfortably operate on those patients laparoscopically compared to open surgery, and usually mobilize the large intestine and retrieve the appendix comfortably. And if required, a drain has to be left to drain out whatever the toxic material which can still happen following surgery. That also is a possibility through laparoscopy. Highest advantages of laparoscopic surgery is hardly any scar left on the abdominal wall, very quick recovery. Maybe today we operate, patient is out of the hospital tomorrow morning, and maybe day after tomorrow patient start working. And very little possibility of wound infection and post-operative hernia possibilities. All these are huge advantages related to any laparoscopic surgical procedure. So I always rate laparoscopic appendicectomy surgery as a much higher advantage when compared to open appendicectomy.